Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon at Vriksh Fertility at HSR and Whitefield, Bengaluru. Did you know that one single sperm can create a baby? You need not have millions of sperms. That's the power of the procedure called ICSI. That is intracytoplasmic sperm injection. ICSI is a procedure which is a part of our IVF process done by the embryologist, a senior embryologist who selects a single best sperm and injects into the egg. This is usually done when the sperm count, sperm motility is very low. This method has helped millions of couples to achieve their dream of parenthood and have healthy, happy babies. Now, is ICSI always the best option? Not necessary. It depends on several factors which we assess prior to your IVF procedure, which involves assessing the sperm quality and the sperm quantity, which can be assessed by certain simple tests like your semen analysis, like your sperm DFI and your hormone assessment. Now, what is the process of injecting the sperm into the egg in this ICSI procedure? And how does ICSI affect the embryo quality? Now, like we discussed, in a traditional IVF, numerous good motile healthy sperms are placed around a healthy egg, while in ICSI, the embryologist selects a single best sperm and injects directly into the egg. Let's break down ICSI procedure step by step. Number 1 is egg retrieval. Under anesthesia, mature eggs are collected by aspirating the follicular fluid from the ovaries. Number 2, sperm selection. Healthy, motile and normal form sperms are selected. Number 3, sperm injection. A trained senior embryologist selects the best sperm and injects it into the egg by using certain specialized instruments called micromanipulators. Number 4, fertilization check. After 24 hours, the embryologist checks whether the fertilization has happened or not. Number 5, embryo development. The fertilized egg grows into a beautiful embryo after it is cultured and kept in the incubators for at least 3 to 5 days. ICSI procedure per se doesn't have any impact on the embryo development, but if the egg quality is very poor or if the sperm has lot of DNA damage which is present, then it can result in poor embryo quality. Is ICSI treatment painful? How long does an ICSI cycle take? Now, understand that the actual ICSI procedure is happening in the embryology lab, which is performed on the egg and the sperm. It has got nothing to do with you. So, you don't feel anything. However, the IVF stimulation part, wherein the ovaries are stimulated to produce multiple follicles, and post-egg retrieval, which is done again under anesthesia, you may experience mild discomfort like bloating, abdominal pain, etc. How long does the ICSI procedure take? Let us break it down. Step number 1 is your ovarian stimulation. It may take about 10 to 14 days to stimulate your ovaries to produce all the follicles, to make sure that all the follicles are growing. Step number 2 is the egg retrieval. It is usually a daycare procedure which is performed on your day 15 or on day 16. It is done under anesthesia and you are usually sent back home the same day. Step number 3 is the sperm injection and fertilization. This is done on the same day. If the husband is not available, we usually use the frozen sperm sample which is provided by the husband or by the male partner prior itself. So, on the day of the egg retrieval, your senior embryologist uses the semen sample and selects the best sperm. Step number 4 is embryo culture. This may take around 3 to 5 days time. Step number 5 is your embryo transfer. If your doctor is doing it in the same cycle, which we call as a fresh embryo transfer, it is done after 3 to 5 days of your egg pickup. Or if it is a frozen transfer, then they may call you back next cycle once you get your periods.